I'm Julie Zenner, and here's what's coming up this week on Almanac North. Minnesota's governor has extended the stay-at-home order until early May. We'll find out how Carlton County health officials are faring during the COVID-19 pandemic. A new book on Duluth from a well-known local author is the first in an urban biography series from the Minnesota Historical Society Press. And we'll hear from the Minnesota Corrections Commissioner about an outbreak of COVID-19 at Moose Lake State Prison. It's all coming up on Almanac North. Hello and welcome to Almanac North. Thanks for watching. Dennis Anderson is home tonight and our show was recorded on Thursday afternoon. This week's show will include our first live interview over an internet video connection. Our other interviews were recorded ahead of time, also through video conferencing. The governor's extension this week builds on an effort to slow down the COVID-19 pandemic. For counties in northeastern Minnesota, that's kept the number of cases at a reasonable level and avoided a spike in patients at local hospitals. Earlier this week, Almanac North producer Greg Grell talked with Jenny Barta, Carlton County's public health nurse, about the pandemic.
So as of today, which is for us, it's Wednesday, April 8th, we currently have 14 labbed confirmed cases in Carlton County.
Now, several of those are at the prison, and there are 5 in the county outside of the prison. Is that correct?
You would have to refer to the Department of Corrections website to be sure, but the Department of Corrections confirmed cases are included in our case count.
So now, as access to testing is starting to improve in the state, are you expecting now to find more cases in Carlton County?
We can expect an increase in lab confirmed cases when access to testing does improve. However, it's likely that we already do have some community spread happening all across Minnesota. So it's important to keep in mind that the majority of cases are mild to moderate, so most people will recover at home and will not require testing or medical attention.
So what are some of the biggest concerns that you are hearing from Carlton County residents about COVID-19?
Well, one of the concerns that we've heard is how fast the spread of COVID-19 will happen in our community. So we've recently released some guidance on homemade face coverings that was recommended by the Center for Disease Control and Prevention as another added voluntary public health protection measure. We've also been emphasizing Governor Walz's order to stay at home as much as possible and continue these primary prevention measures such as washing your hands, using alcohol-based hand sanitizer when you can, also covering your cough, staying home if you're feeling sick, and maintaining that good social distance from other people.
Now, there do seem to be some encouraging signs. The governor's stay-at-home order may be working. The Minnesota Department of Health shows that the spread seems to be pretty flat. Is that encouraging news for public health officials like yourself?
Yes, in fact, it is. The Commissioner of Health has shared that they've been working on ways to track this effectiveness in order to stay at home. So we've not seen a steep, sharp rise as other places have seen. So initial results show that it is helping to flatten the curve in this pandemic, at least in our neck of the woods. Based on current cell phone data too from the Department of Public Safety, traffic in the month of March has decreased by 71% in northeastern Minnesota. So that is showing that we are following this order to stay at home as much as possible.
Yeah, that's good news. Good news. This weekend now is Easter, and that's a traditional time for family and friends to gather. Does that bring along any increase or concerns about an increase in the infection rate?
Yeah, in our recent press release, we had tried to reiterate the importance of staying at home and not gathering in large groups so that we can continue in this effort of slowing the spread of COVID-19. We're encouraging people to celebrate holidays, but try to celebrate them at home at a safe social distance. So we know that many of these family gatherings could include people who are at higher risk for complications for COVID-19, such as anyone over the age of 65, especially those with underlying health conditions. So we want to continue to protect that population as much as possible.
Are there any additional things Carlton County might be doing also to limit the spread? I know you're following the Department of Health recommendations and the CDC recommendations.
Yeah, we're trying to send out messaging to the public in different ways, such as through our daily press releases, social media, and also through our website. And we're working currently on a community mailing. County services have now limited face-to-face contact. We've adjusted those services to provide some of them via telephone or through a secure video conferencing service.
So there are resources out there. People should be looking for those resources.
Yeah.
Do you have some general recommendations, information for people at higher risk that they should really be paying attention to?
Yeah, so if you're somebody who's at higher risk, we are really encouraging you to stay at home as much as possible. And if you're able, reach out to family, friends, neighbors to do shopping for you instead of you going out into the community. Also for community members to be checking on their neighbors or family members who might be at higher risk and trying to provide needed services for them. Continue to wash your hands frequently. If you do need to go into public, you can use those face coverings that the CDC has recommended, and MDH has also sent out some guidance on that. But keep washing your hands frequently, and also contact your healthcare provider if you do feel like you're experiencing any symptoms, and contact them early rather than waiting until later.
And where can people get the most up-to-date information if they're concerned about the spread, especially in the county and in the area?
Well, you can check out our website, www.co.carlton.mn.us. And also, please continue to check out the Minnesota Department of Health website. They have COVID-19 web updates every day, as well as the CDC is coming out with new guidance and recommendations daily. So those would be your best websites to check.
Are you worried at all about the public health infrastructure in Carlton County? Do you guys think you're pretty well prepared for whatever may come?
I do believe that Carlton County has a very good public health infrastructure. We've been working with an incident command system already for the past few weeks. We've been having daily meetings, and I believe that we have some good plans going forward, as well as working with other community partners like Fond du Lac and other Northeast counties. So I think we're going to be doing okay.
Well, Jenny, thank you very much. Appreciate your time, and good luck taking care of this in Carlton County.
Yes, thank you so much. I appreciate it.
Well, we all could use a break from coronavirus coverage, and our next guest is here to help us think about other things for a few minutes. His new book, Duluth, an Urban Biography, is the first of a series from the Minnesota Historical Society Press. Joining us now from his Duluth home is Tony Dickens, the publisher at Zenith City Press. And welcome, Tony. It virtually feels like you're right here in the studio with me.
It's virtually strange, Julie, but thanks for having me this afternoon, and I'm glad everybody's safe and healthy over there at WDSC.
And I hope it's the same in your household.
Absolutely.
Well, now, you normally write and publish books for your own company. How did you get involved with this Historical Society project?
They have had this idea for a few years of a series of urban biographies. They're doing one on Rochester, Minneapolis, St. Paul, and Duluth. 4 biggest cities in Duluth. And I was approached by Ann Regan, the editor-in-chief, a couple years ago, and we talked about it. And it's a project that other people have asked me about doing similar projects to over the years. And I thought, great idea, but it's there, so I'm gonna join up with this group. They're good, they're dedicated. They do a wonderful job with the Historical Society. So I thought it would be a great chance to collaborate with someone else rather than take it on myself.
Now, 2020 is Duluth's 150th anniversary as a city, but your book goes back even further in history and looks at what it was like around here before Duluth. Why was it important for you to go back farther and maybe lay that groundwork?
You know, I joke that the book goes back 2.6 billion years to the formation of Lake Superior's bed. But the important part of the prehistory, because an urban biography is supposed to focus on the city, the municipality, Duluth, which founded as a town in 1856. But we have so much rich history before that. And of course, with the Native Americans were here for thousands of years before the European settlers who founded Duluth as the town and everything. This place was home to many peoples before it was home to those of us who consider ourselves Duluthians or who have since the 1850s.
Now, you selected some of the photos from the book to share, and maybe we could look at those images of early Duluth and you could talk about them a little bit. The first one, Duluth in 1873. What was the community like at that point in time?
Well, I chose that picture because it's one of the great ones of early Duluth, and it is, like you said, 150 years back. So what was life like back then? You know, there was only one or two buildings made of brick in town. They're all made of wood. The canal was just being developed with its wooden piers at the time, and you get a great view there from the top of the hillside looking out at Minnesota Point. That was Duluth. It only stretched from 3rd Avenue East to 8th Avenue East, from about 5th Street to further down Minnesota Point at the time. So it was a much smaller community, and that picture kind of encapsulates it for me, that perspective of just how small it was.
Mm-hmm. Now, Duluth has long had the nickname of the Zenith City, and you've kind of even taken on that name with Zenith City Press. Where did that name originate?
That is a name inspired by hope for the future. You see, in 1868, we were pretty certain Jay Cooke was going to bring his railroad, Lake Superior, Mississippi, and Northern Pacific Railroads, to terminate in Duluth, and we were so excited about it. Our newspaper editor, who hadn't even published an issue yet, Dr. Thomas Foster, who you see there, gave a grand oration on July 4th, 1868, and he said that the future Duluth, all roads would lead to it. It would be this giant shipping center, and Duluth would be the Zenith City of the unsalted seas, and it's had that nickname ever since.
You mentioned the railroads, and certainly the railroads were an important part of both the booms and the busts of the community over the years.
Absolutely. Duluth had started in the 1850s, then there was a big financial panic and everything went from boom to bust pretty quickly. And then in 1869, when Jay Cooke actually announces he's bringing the railroads here, we boomed. We went from less than 200 people to 3,100 in less than 11 months. Mm-hmm. And on March 6th, 1870, because of Jay Cooke's investment, because of those railroads, we became a city for the first time. And really, it's what gave us the advantage over Superior, and why Duluth became the Zenith City.
Mm-hmm. Every city has its tall tales, and Duluth has one that has persisted about the construction of the canal. Talk about that a little bit.
Well, this is one of the great stories of Duluth, and I call it our defining creation myth. We dug the canal, and there were lawsuits that filed because Superior thought it was a move that really did, and in fact, it did hurt their shipping and hurt the growth of Superior. But the tall tale is that we heard that there was going to be an injunction delivered to stop the digging of the canal before it had even begun. And so the telegram arrived on a Friday, and on Saturday, 100 stout men with shovels and pickaxes dug the entire canal by hand in a day and a half. And that ended the battle and the pursuit and the whole thing. And it couldn't be further from the truth. There's so many versions of the tale that have propped up over the years. It's just fascinating. We discussed them all in the book, but for me, it's that, this tale, I think, persists because Duluth's history is a series of picking itself up, these booms and busts, and the face of adversity, and the fact that 100 local guys would get shovels and dig a canal just for the sake of the future of the city is a great story.
We're in a period right now that people are talking about very historic with COVID-19, and some have compared it to the 1918 Spanish flu. What were things like around here during that, and what can we learn from it today?
Well, Duluth and Superior closed down for about 7 weeks. Restaurants, churches, schools, gathering places, theaters like that, but everybody kept going to work, right? So you had these large factories with thousands of employees in there eating lunch in large cafeterias together and situations like that. So, while we did have a similar ban, it wasn't quite the same. It lasted about 7 weeks. It was very fascinating times. And tragically, the day after we put our stay at home in place is the day the 1918 Cloquet fires began. So we had at the same time fire refugees, flu victims all at once here in Duluth, and it was quite different than what we're going through today.
Now, your book carries that history all the way up to the modern day. Any thoughts about pulling it from the shelves and writing an extra chapter before you release it?
No, I'm glad we this is another game changer of history, this pandemic, and things aren't going to be the same. So ending at the fall of 2019 with the last mayoral election in Duluth, just before Duluth starts its 150th year, I thought great place to stop.
All right. Well, this is a great place for us to stop too, although we could keep talking with you for a lot longer. You do have a virtual book launch for Duluth, an urban biography, scheduled for April 15th at 7 p.m. Quickly, how can people access it?
Go to Minnesota Historical Society or the Historical Society Press or Xena City and follow us on Facebook.
You're wrapping me up. Thank you, Tony.
All right.
Stay safe, stay healthy.
Thank you. You too.
Minnesota's Department of Corrections is dealing with an outbreak of COVID-19 at its Moose Lake facility. Greg Grell talked with Paul Schnell, Commissioner of the Minnesota Department of Corrections, about the situation.
The last week has been very challenging for staff as well as for the incarcerated people who live there. Right now, we have at present 9 people have been confirmed positive, 9 of the incarcerated people confirmed, and then we have another 22 people who are presumed positive. And by presumed positive, we mean that they have been symptomatic and have had close contact with a known positive person.
So what type of steps are you taking in Moose Lake then to try to keep the transmission down?
So across the entire system, we started out very early in this process about almost 4 weeks ago now, putting hand washing stations, doing employee screening as people come into the facility. We tried to reduce as much as possible some of the transfers between facilities, although we've had to do some of that in order to manage our population just across the entire system. And then inside, since the COVID outbreak in Moose Lake, we've done a variety of moves of people into different units to try and get quarantine and separation that ultimately to stop the spread. And right now, I'm cautiously optimistic that we are in a spot where our numbers are not going up, they're stabilizing, and we hope ultimately through containment and other just regular practices that all of us should take, that we're going to turn the corner on this and see it go down.
Now, I know you also are working with the Minnesota Department of Health on this. What type of things have they assisted you with?
We've been so incredibly almost embedded. We have an epidemiologist that's really working with us, and we're having multiple conversations daily with that epidemiologist and talking about containment strategies, quarantine, how we monitor. We just started the issuing masks, barrier masks. So it's cloth barrier masks that actually were made by the incarcerated men at Moose Lake, have been issued to all the staff at Moose Lake, and all of the incarcerated men there. In addition, those masks are going to be ultimately, the goal is to make about 14,000 of those masks and distribute them to every single staff person and every incarcerated person in the throughout the DOC. And all that does is just like for anybody, it provides that protection for others. It's that kind of catcher's mitt, so to speak, that allows others to be safe.
How is the staff and the inmates? How are they handling this? How are they holding up during this?
I'm really glad you asked. I gotta say, first of all, that I'm so immensely proud of our staff. Just like healthcare workers, they find themselves in a situation where they know that there's more than 20 people who've more than 30 people who've been infected that we believe are infected, and some known, some presumed. And yet these people are coming into work, they're doing what they need to do, they're very, very professional. And I think similarly, the people, the incarcerated men at the facility have really been incredibly patient. For all of us, this is such a change in our lives. And I think if you're a person that's incarcerated, you obviously you're concerned about yourself and what all this means to you. They don't have the flexibility of being able to, go to the basement or to, go to a different room in their house. They're going where we require them to be. And I think on top of that, they also have concerns for their families, and their families have concerns for them. And I got to say that I'm really impressed with the level of patience and the cooperation that we've had from the population there. And I think it just speaks to some of the communication that has been happening, that's been positive, not perfect. This is a brand new script for all of us, and we've worked our way through it, and I think so far so good.
What about the inmates that have been diagnosed with COVID-19? How are they being handled within the facility?
So what ends up happening is, and some people you've heard about move to segregation or restrictive housing. There were moves that took place early on. Each of the wardens throughout the DOC at all of 11 prisons identified places where we could put people into a quarantine status. It was not disciplinary, but it just allows them to be separated so that we contain spread. We were using that. Now some of those segregation area, people still had access to books and those sorts of things that you would want to do, but it is a little bit more restrictive because it's harder to get access to phones, and yet we're not trying to keep people from them. It's really more about trying to contain spread. Now we're running a step-down process where after they show no symptoms for a number of days, then they move to a more open area before they get put back in general population. So we've developed this process in concert with the Department of Health, and so far so good.
I also understand that you've expanded the work release program, and some inmates are being released a little early. Is that correct?
In general, what the plan is that we will take people that we know are within 90 days of their regular release, that they're going to be coming back to whatever community they came from. And we will move them to what's called a work release status. It's not just work release. It can be job search or work. It can be school, treatment kind of activities, vocational training. All those types of things are permitted under that statute. And so we will move some people out to that status a little bit early. At any given time in Minnesota, there are several hundred people on work release. So all we're doing is expanding this program with people who are in prison for nonviolent offenses and coming up on their release date. And the goal of that is really simply to try and get additional capacity in the prisons so that when we do have the next outbreak or series of outbreaks, we have the flexibility to move population within the facility so that we can contain spread. That is entirely our goal. We knew going into this that there was a high likelihood that COVID would end up in our correctional facilities. Our goal from the beginning was to try and minimize spread as much as possible.
And then finally, Commissioner, what are you doing? How are you handling the incoming prisoners? What is the intake process with that?
That's a great question, and that's been one of the big changes that we've had to make in a very short turnaround. Generally speaking, if somebody comes out of court, they've been sentenced to serve a sentence at the Department of Corrections, they will go through an intake process at the correctional facility in St. Cloud. That's central intake. But people who were returned on a release violation, let's say a technical violation where they failed to report in with their agent or whatever, and they were sent back to prison for a short period of time as a sanction, those people would have been in the past sent back to whatever correctional facility they were last released from in most instances. And we really had to change that because obviously we want to reduce the number of outside people that are coming into the facilities. Right now that's limited strictly to our staff, are the only people coming in. And so what we've had to do was we run all intakes, including release violators and new commitments from the courts, through St. Cloud, and they go through a 14-day quarantine before they end up in general population. And after that quarantine period, we will begin to have to move people to other facilities in order to give St. Cloud enough open beds to be able to continue to take new people in. So there's been a lot of movement. It's been a lot of work, and they've done a great job of managing this so far. But it's not without a few little wrinkles here and there. But we're making it come together, and so far it's been effective and worthwhile.
All right. Well, Minnesota Department of Corrections Commissioner Paul Schnell, thank you so much for joining us. We really appreciate it.
Thanks for having me.
Corrections officials this week implemented a stay with unit plan to fight COVID-19 in the prison and protect inmates and staff. Well, if you are feeling ill, Essentia Health and St. Luke's both have hotlines. They are answering 24/7 to help you. Take advantage of those and other resources available online as we all stay home to flatten the curve of the epidemic. And while you are at home, keep up with Almanac North on our social media channels. You'll find us on Facebook, YouTube, and Twitter. And don't forget the WDSE website is the place to go for program updates and more information about COVID-19 special programming here at the station. Stay healthy, everyone. For the crew here at Almanac North, I'm Julie Zenner. Thanks for watching. We'll see you next time.